Hi, this is Gail Trauco. Today we're going to talk about grief associated with aging. Well, I'm just a little bit more than 50 plus fabulous, so I am certainly an expert at aging. One of my favorite people to follow who discusses aging is Suzanne Somers. And Suzanne Somers and I have a lot more in common besides just both being blondes. I've certainly not been on TV in the way that she has, but I am most certainly clinically educated enough to know that some of her books have outstanding information. As we age, this applies to both men and women. One of the things that change in your body are your hormones. There are two physician practices that I'm aware of that are both nationwide, BodyLogic MD and ForeverHealth.com, that have physicians that specialize in something called bioidentical hormone replacement therapy. This was something I did 2 years ago and it certainly changed my life. I had chronic fatigue, wasn't sleeping at night. You know, I may have some mood swings, which, you know, once you go through menopause, you should kind of level out. Well, that didn't happen to girlfriend here. So I was still having them. I kept hearing about BodyLogic and BHRT. So I made a consult and went to see a physician in Atlanta who is a bioidentical hormone replacement therapist. Well, within 60 days, I saw a change in the quality of my life. I had energy again. I was sleeping all night. He put me on an appropriate vitamin regimen as a bariatric patient that I already wasn't getting. He checks my levels by DNA as well as blood testing every 90 days. I'm not being paid from BodyLogic MD or ForeverHealth.com. I'm sharing with you a life experience that I have had and one that has been just a changer. It has allowed me to write. It's allowed me to get back on track. It's absolutely enhanced every single thing that I do, including going to Atlanta Hawks games and being able to stay awake during every game and having a great time. I encourage you to do the same thing. And when you go to your front porch, once you are back at that place, you are going to find that you're able to even grasp any grief cycle that you're in. Any of the ones that we've talked about, you're going to be able to identify what grief cycle you're in, what state, what phase of grief are you in. It's going to let you know if you've been through it 10 times. If you've gone through one 10 times, that's probably too many and there's something else wrong. It may not always be clinical depression. It may be another physiological parameter that needs to be evaluated. And many times for those of us who are 50 and older, it's hormone replacement therapy that needs to be evaluated by a physician. I'll leave you with that today. If you go to see one of these physicians and you get on hormone replacement therapy over the next 4 weeks, how are you feeling? Share that with us as well. You can find us on Facebook. You can also find me on YouTube with the blog. Contact information is always there. I look forward to talking with you again. Thank you.